Okay. All right, everybody, I guess we'll get started.
Yeah, I'll take it.
Thank you. Okay, so welcome. I'm Dr. Denise DeRosa, physical therapist. This is baby Charles III. He's our demo baby today. Welcome to our first Movement Matters class. I'm a pediatric physical therapist. I've been for 7 years now. And these kinds of classes are just like my dream to do. So I started them in Staten Island with my speech language pathologist friend. And then Dr. Gigi and I teamed up to make it more motor focused here at Movement Matters. So thank you for letting us host. And I'll let her introduce herself.
Sure. I'm Dr. Giselle. Nice to meet you guys. I'm fairly new to the community here, so we're super excited about hosting this class and just sort of introducing how early movement can really benefit babies in terms of development and all of those things. I find that a lot of parents want to buy all these things, but you really don't need a lot. And so if you walk away from anything here, I want you to feel comfortable just putting your baby on the floor with the confidence that knowing that that's the best thing for them and you don't need to have all these devices. We'll have like a few minutes at the end to do like Q&A, so to answer any specific things. I've been a PT for 22 years, a pediatric PT for 15 years. And so anything that comes up along the way, hopefully we can help answer. Also, I'm a mom of 3 and Denise has 2 kids. So just as moms, we're here to help and support you on your journey. So we'll start.
I'm so sorry.
With some movement and show you a couple of different things. And we'll be around to like help you guys if you have any questions. But maybe we'll just go around quickly and just tell us who you are, where you live, how old your baby is, and a fun fact.
First, sure.
Okay, I'm Shannon. This is Ryan. This is Kieran Rose. She's our first, and she is 1 month and 1 week old. We live in Bridgewater. And a fun fact is we have a dog who's absolutely obsessed and in love with Kieran, which is really nice.
That's awesome. Inga, go ahead.
Hi, I'm Inga. This is also Inga. She's actually the 4th, technically. It's like a matriarchal thing we have going on. She's 3 months and a week or something like that. And fun fact is, I actually trained as an opera singer, so I'm very into like movement and placement and all pellet things.
That is so cool.
Yeah,
that is a fun fact.
I'm Jessica, and this is Ainsley. She's 3 weeks old. We also live in Bridgewater. And our fun fact is
The premonition, I wanted to play on the LPGA tour.
Ooh.
Hoping that's a fact.
Hello, welcome.
Hi, I'm Dara. This is Armand. He is 2 months today. This is my second.
Happy birthday. Happy birthday.
And we'll go from White House Station, so a little further away. And we also have a dog, Kaya. She's a German Shepherd. You think she'd love the kids? She doesn't care for them now. Well, she watches after them, but that's about it.
Well, welcome.
Hi, I'm Sherry. This is Hudson. He just turned 3 months old. We're in Piscataway. And a little fun fact is my husband works next door as a chiropractor. Yeah, so fun fact there.
It's actually hilarious because he peeks in here to see
Yeah,
what's
he
going
peeks
on
in.
all the time.
Wait, that was his boss there. So
That's right. He came in here and he was like, my wife's pregnant.
yeah.
We
He
want
was
everything
excited.
in your office.
Yeah. So Hudson's doing really well here and learning a lot.
Yeah. Cool.
All right. And
And you
we
did
are
your
from
intro.
Staten Island, which is the farthest, I think. So if anyone doesn't understand my accent, I'm happy to repeat
From
it.
Long Island originally.
Oh,
Born and raised.
Oh, he's
that's
New
the wrong
Yorkers.
island, they say. All right. So I like to start by just having everybody repeat to themselves. My baby is unique, and I will enjoy this moment with them. you physically have a lot of little babies, but it can be like the same age or a month apart and doing completely different things. So we're also gonna take this moment, enjoy and play with them. Hello, welcome. Come right here next to me. And then we'll get started, okay? All right, so we're gonna start actually with a hold. So everyone pick up your baby, stand up. All right, so we're gonna do a baby facing out hold. All right, so everyone, hold your babies in front of you. Yeah, you want them like at the middle of your chest. I like one hand on belly and the other hand under the bottom. You can tell we do this one a lot. I did it a lot also in the first 2 months when he was pretty gassy. And then if you want, you could place the feet together, get a little hip flexion. Dr. Gigi showed me this one. It's good for like babies feeling their feet. And all these babies have socks on. Oh, 2 babies don't. So try to do without socks too, because it's just good for sensory input into the feet. You don't have to take them off now, but I'm just saying like you can do that.
Yeah.
All right, and then what you're gonna do is just like walk around your house like this, all right? Should we do a conga line style?
Yeah, sure. This is like my party trick, by the way. Like at church, I like grab all the crying babies. And people are like, how did you do that? So it's like kind of my claim to fame, this one. So you can impress your parents and grandparents.
All right, so let's follow the leader. Let's go this way. So as you're walking with your baby, you're going to narrate your environment. Oh, there's another baby. There's the wall. It's a rainbow. And you know, it's never too early to start talking to your baby and encourage communication.
That's right.
So, you know, feel free to just tell them what you did yesterday, what you're doing today, what you're doing tomorrow. Oh, this is this. Oh, this is that.
Get it to her at the same time.
All right, make it our way. Go, okay. Very good, everybody. Hello, friend. Hello, friend. If you have, if anyone has any other kids, this is good for like follow the leader. Come on, let's go for a walk.
Taking a nap. Sounds nice.
All right, find your spot, please. Yeah, there you go. Awesome. Sometimes it's nice to your environment. All right, so we're gonna get into like the meat and potatoes class one more time. So you can place your baby down on their back on the floor. And all these babies are fairly, oh, you want to introduce yourself? Nice to meet you, Elsa. And who's this? Nice to meet you. So, what was I gonna say? Yeah, we just like intro and walk in.
You didn't miss a lot.
Where are you from?
Roselle.
Roselle.
I'm new to Jersey.
Oh, where are you from?
Staten.
Oh, very good. Very good to hear. I don't know what to say my accent. Yeah. Well, people either go from Staten to Jersey or Staten, Florida.
Oh, there you go. I'm the only Canadian.
All right, so we're gonna start. You guys can grab whatever toys you want. I left some toys on your mats, but you could also use the love everything there. And I want you to try and encourage baby to look at the toy and then turn heads right and then to left or left, right, doesn't matter. So it's like this, and we want them to turn their heads. Now all these babies are a little young, they may not reach yet, but that's okay. We're just introducing the movement. If the baby's not turning so much, that's okay. We're just gonna come place to start. And this is a good way to see like if there's any asymmetries. So like the baby has no problem turning to one side with it and then doesn't turn so much to the other side, you could be aware of that and start working on it.
The other thing that's worth mentioning is this is actually the first milestone that we look for. It usually is, emerging and out by 8 weeks. So if your baby is younger than 8 weeks and not doing this perfectly or crossing their eyes, that's fully normal. By 8 weeks, we want to see that they can track all the way side to side and up over their head and down and near and far. So that's
That's good. So even let's push the toy like above and try to like reach back a little bit. So like open the line to give that real.
I have a video.
Good. Okay. And another way you can play here in supine is just making raspberry sounds with baby. If you feel stupid, you're doing it correctly. And they may not make raspberry sounds yet, but if you're introducing that sound to them, they like it, and they're more likely to do it back, doing it randomly on their own. I see that baby.
Look, I'm gonna set this down for you.
Next one right here. You know what? Hold on a second. Hi, Mom. This is weird. Why can't I? Danielle, can you see me? Give me a thumbs up. Can you see me? Yeah? Okay. I just want to make sure.
But both, one of them needs to be muted.
Okay.
You're echoing.
All right, cool. We're gonna work on one more skill here in supine, which is anticipatory play. So it's kind of like teaching your baby how to interact with you. So you grab your egg shaker and you're gonna do like 1, 2, 3. And so on 3, it's kind of like you do something else and baby like that expects it. So it's like shake, shake, swoop, shake, shake, swoop, shake, shake, swoop. So you see like on the 3rd, he starts smiling because he knows what's happening. All right. So it's like 1, 2, 3, and you can say whatever you want and make whatever sound you want. Because egg shaker I like, but whatever you want. So try it out. Shake, shake, swoop, shake, shake, swoop. You're eating your hands. Shake, shake, swoop, shake, shake, swoop. Shake, shake, swoop. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. And you don't even need an egg shaker, guys. You can use your hands if you want. You can use whatever you have. Shake, shake, swoop. Shake, shake, swoop. Shake, shake, swoop. Shake, shake, swoop. Oh, look at him. All right. If anyone has any questions so far, feel free. But we're going to get into the next position, which is sideline slice. So you're going to take your baby. You're going to set yourself up like I am. I find that this is the best way, especially if they're younger. You're going to use like your tibia bone right here and their spine to touch one another. So they're on their side fully, and they have your leg as a support. All right. And then you're going to take your book and like put it up like this so they can actually see it. All right. Okay. Oh, where's that going?
So this sideline position is like the secret sauce of so this is like a physical therapist's secret to figure out if there's anything going on with the baby. So you guys put them on their side and just watch them. Put them on their other side and again watch them. You'll see if they struggle or don't like it. Babies don't hide anything, right? So they'll tell you if they aren't loving the position. And I'm not saying to keep them there, but it just gives you information that maybe there's something that's stiff or something that's tight or something that needs a little bit of stretching. Stuff that we work on.
So everybody try one side with the book, like Charles is doing. And they may not reach yet, like I said before, but at least you get them that input. And if they're not perfectly on their side, that's okay too. It's just to start, just to try different positions, because sometimes, you know, like even with him, you play on the floor, you can only do so much for so long. If they get bored, and you're like, oh, what am I gonna do? Pick them up. Try to switch positions first. Oh, you're eating that? Good. And you guys can use, you could do the same thing here in Sideline. You could do the shake, 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 anticipatory play. You could do the looking in both directions on their side. Good. All right, good. When you're ready, let's switch them to the other side. And then it's a good way to compare too, if there's any kind of preference too. Some babies like laying on one side and not the other side, which you should just monitor and be aware of, and call us if you don't see a change. This is my one plug for the day. Booga, booga, booga. Hello. Over. Hello. Over. Hello. Chucky.
Well, I remember
Bless you. All right. I have that same thinky thing. Yeah, I love it. It's nice when you get a little older and then you start chewing, you can just grab that part too. Yeah. Just like in the car. Oh, that's funny. You throw already? Oh my goodness. All right, you all know what's coming next. Belly time. Yes. So if you're here in Sideline, very easy to go over. Tuck the arm under. I like to go with the hips. You got to get his attention down. Here, buddy. You don't want to do it now? Okay. And I just like to pull at the pelvis and let him do the work. Yeah, so if the arm gets stuck, try to let them figure it out first. And if he doesn't figure it out, then you give him a little assist.
How do you do? I mean, you know, we'll go a little bit. He's right now. He's been like that happy.
As long as it's up nicely underneath.
Yeah. I was gonna take some shit.
That's fine. It's right here. So in prone, on bellies, depending on how old baby is like what they'll do. So like our little youngins over here are just like very comfortable to lay like that, just like comfy like this. And then what you could do from there is you can, this is fine, let her sleep like this, watching her, of course. And then, you know, turn her head for the next nap. Do the next nap with her head turned the other way, just to promote symmetry. All right. So Charles here, he's 4 months, so he's able to breath, obviously. He's able to kind of prop up on his elbows and push himself up a little bit. And his next step will be going on his hands. But right now, it's fine to just let them play around with their hands and arm position. I like a tucked arm, and then you get your toy that's like up a little higher to promote them with neck extension. So all these toys, or if you have like a block and you put something on top, or like with the Love Every Match, you have the mirrors. So those would be good to use at this point. The mirrors to try to get them to look up at themselves. And she's sleeping over there. She's like, she's like. All right. Yep, and you could use your choice to try and get them up. She looks so good over there. There we go. Yeah. I don't think you're allowed in this class unless you're a tongue-tied baby. Just kidding. I don't know if anyone is. I'm just making that up. Yeah, that's all right. You know, it's becoming more and more, you know, in light. And thank God people like Dr. Gigi are here to help us all as parents, because it's a scary thing. Even as a PT, it's scary. So yeah, so here, and you know, just because it's a tongue-tied baby doesn't mean they're gonna have long-term effects of it. Like, she looks good, you know, and we just keep up with it. So we're trying to get them to look up and then look side to side. Hey, buddy. Whee! I love this little crow in the sun. That's the best part. So funny. He's trying to crawl over there.
He is.
Oh my goodness.
But he found his hands like 2-3 days ago, so that's good. He was put his hands
Oh.
Absolutely not. Not today. He's a very dark tomorrow. Yeah. Try to get his arms underneath. Hello, cutie. Hello.
Yeah, like the snapshot in time. So you can practice it later, tomorrow, you know, they're all different, they're all different. I don't want to. Yes. For an hour, yeah. We rushed out of the house.
Yeah.
My husband and I would be at work, we have like cars. That's a lot of running around. I'm walking it. Yeah, watch, take it in.
Yes, like
Okay, any questions about that? How's everyone doing? All right. I also like sometimes, like if you guys are gonna get down on the floor with them and play, you could put them like in front of you like this, and then you could get down too and like talk to your baby and stuff like this too. Just so they see your face, they really love your face. That's their favorite toy. All right, so it's 10:32, which is great. Does anyone have any questions about anything we did so far before we get into the next thing? Good. Okay. And just because, you know, they may not do it right now, you still just take it in, learn, and then practice later, because babies are consistently inconsistent, right? You know, every week they change, every day they change sometimes. Sometimes they sleep 5 hours and the next night they might not sleep at all. So, good. All right, so we're gonna get into the next thing, which is like a prop sitting. I put this in because I thought we'd have some more older babies, but that's okay. So you're just sitting, and I actually like to sit them up on your leg like this, and then you're gonna hold them at the trunk. They're just sitting up like this, and as they get more stable in their core, you could take your contacts down into the pelvis a little bit more, so they have to work at their core a little bit more. Whoa. And the younger they are, the more support they're gonna need.
So for her, you could have her more sort of here.
So try to put your hands down a little bit. Okay. Yeah, so you can do, he probably doesn't need all of this, like Kira know that she needs like a full thing, she's a baby. But for him, they start to have some head control and stuff. So I like to be here.
Yeah.
He thinks he's grown. I'm sorry, can you see? So all I have is I have him, I'm just holding him like this and I'm sitting him on me like this. And then as she gets a little bit more core stability and core control, you move your hands down into the pelvis. And then you see he has to work harder to keep upright.
Whoa. Of course, he's mama or PT. So take that with a exercising all day.
Yeah, he's got no choice.
So we'll repeat this as the weeks go on, so you'll start to see how your baby changes and improves and gets stronger along the way.
I think that's all that I have. Do you want to add anything in?
No, I love it. I think that for that one, so I wouldn't expect a baby to have good head control in the first 12 weeks of life. They're still getting strong. I was saying this before, a baby gets strong from their head down towards their feet, and that's why the last thing they do is walk. Once their head is strong, their trunk and their core is strong, then their legs get strong, and then they stand up and start walking. So just be patient with them, okay? But yeah, if their heads are wobbly, then you're not gonna hold them here because it's too much pain. So you can hold a little bit up here maybe, or just have them leaning on you as they learn to get that head stronger.
All right. All right, so we're gonna do our last 15 minutes of Q&A, and you guys can ask us literally anything. And I'm sure if we don't know the answer, we could find someone who does have the answer for us. All right, Elsie, you wanna go first?
I'm playing
Skip?
right now.
Okay, Skip. Guys, you have questions? Could be about anything, sleep, eating, fine motor, gross motor.
First question we had was noticing that Kieran favors when it's not oral, but you were talking to us about how to roll her back and forth a little bit. So I was working on that. So because she just keeps always looking left.
Okay.
She'll go right, but she prefers being on the left.
It's like super observant. I'm really proud of you guys for even noticing, but a lot of parents notice when they're looking for the camera roll that the baby's always facing that same side and never looking the other way. So sometimes that's the first indication. The other thing I find is grandmas, when they come, they're the ones that pick up on the fact that the baby only turns one way. So even though they drive you nuts, sometimes they have valuable information to share with you.
I'm taking credit for this discovery.
But my suggestions for that are when you put them down on the change table, put them facing this way one time and then this way the other time, because they'll always want to look at you. So just encouraging them in a really gentle way to look that way will help them. So in the physical therapy world, we believe in movement. My husband is actually a pharmacist, so someone will say to us when they find out what we do, they're like, "Oh, I got back pain," and of course he wants to recommend like Tylenol and Advil and all these things. And I'm like, "No, you need to stretch." And so there's a lot of different ways to treat things, but I feel like movement is just such an easy way to get them going. So we don't stretch or force them; we just gently encourage them to move in that way. All right. So, and you'll see that when you're here, how stimulating them on one side will motivate them to turn that way.
And the only thing I'd add to that is like, look around when you go home, like your space. Like if you have her in the same spot that she wants to look at the dog all the time, right? Like the dog and her love each other. And she's always looking at the dog in this position. Turn the seat the other way too.
Yeah.
So just evaluate your space.
Okay. That makes sense.
One question actually is that she tries to stand a lot. I know, it's like she'll like engage her legs. She's like, I just want to be up, like, on like a sitting position. And I know like that's very early.
Do you want to answer this
Yeah,
one or?
We could both answer.
Yeah, go ahead.
I would say I get this question a lot. Like a lot of babies, like they want to be standing, want to be
Yeah.
upright, and then you have the grandparents who are like, "Oh my God, he's so strong!"
Yeah, exactly.
Like with this one, like he's like,
Yeah.
"Wow, he could stand!" Like it is fun to do, but it's not actually like a skill or anything.
No, yeah. I didn't think
So
that.
what I tell parents, like, oh, if you want to do it for fun and stuff, like once in a while,
Yeah,
it's
that's
okay,
right.
but like don't put them in a stand or anything like this. It's
No,
way
no,
too early to
absolutely.
do that.
But just if she's like wanting to go that way, I'm not encouraging.
Exactly. They're not encouraging it. Discouraging. I mean,
Yeah.
you could do it like once in a while. Like
Right.
I think I don't like the answer of never do it,
Right.
because it's not realistic. I'm a parent too. Like it's not realistic. So sometimes you want to just stand and like be like, oh yeah, wow, you're amazing, and you just take them out of it and then you like move on.
Yeah.
Absolutely. The thing is that the legs obviously are much stronger than the core. We know that just as regular adults, that the core is much harder to engage. So once they learn that these muscles, their quads, their glutes can kick in and stand, then they don't want to use the other muscles. And so by allowing them to really grow, like I said, from head to toe, it just allows the proper foundation so that when their legs are good to go, they're stable. Right now, there's actually something called a walking reflex. And actually, I'm getting geeky on you now. But babies are born with a reflex to actually walk and move their legs. It actually disappears after a while, but if you put them down, they actually, can I show you? Yeah, they take like, but if you are going to put weight through them, I would say make sure you're supporting them. So you're going to be their core strength to allow their feet to be down. Okay, so make sure you're giving them good support. And Denise alluded to this before, those like standers and jumpers are like, we see so many kids that have been in those and then they try to reverse all these bad habits. And so they're not good for natural normal development. It's so tempting to use them because you kind of have your baby and they look like they're having fun. But it actually causes a lot of issues with their joints and hips and things like that later on.
Yeah, I had someone in my class last weekend, and the baby's like not like baby's here and not even getting into quadruped to crawl, which is like she should have done a month ago. And mom's like, I put her in the standing thing all day because you had the older kids. So that's kind of like what happened there. So, but even with containers, if you have it, put them in to take a shower.
Yeah.
But and it's for like to put out your fires kind of thing, or like you need a minute. You just need a minute. We all need a minute. But don't go out and buy one.
Definitely.
Honestly, I pulled my third child out of daycare for that reason, because they had the cameras and like each kid was in a different thing. They moved from the bouncer to the swing. To
Oh
the
my
rocker.
goodness.
I was like, I can't do this.
It's
And
a
I'm like,
nightmare.
no, like nobody's crying in that room, which is fine, but they're also just, and I was like, can you put them on the floor? And they're like, oh no, that's dangerous. Okay, thank you.
Oh my goodness.
So,
All right. Question?
So we have, like, we suspect maybe a tongue tie for her, and I don't know if this is, but are there any kind of like stretches or something that I can be doing with her
That was my next one.
to like, maybe help strengthen her mouth and tongue and all that, or?
I'll answer this one, unless you want to.
no, go for it. Tell them
So-
why you can answer it.
So first off, I would think, why do you suspect there's a tongue tie? Because it's very popular, and as parents, like you go online and like all you kind of see is this stuff, and then you like look inside and you're like, oh wow. So like, why do you suspect?
The pediatrician and lactation consultant both said that she has one. Now, we don't know that it's going to like functionally problematic for her. We had an issue early on breastfeeding, but she seems to be doing well now. So yeah, like that's my thing. I don't want to jump into anything.
Right, of course. So we always, like as physical therapists, we look at function. So functionally, if she's able to do everything about her day without an issue, I wouldn't fix something that's broken, although there's like some talk about like long-term issues, which I'll let Dr. Giselle talk about if she wants to, but I would say, like, in terms of what you want to do for that is just what we did today, you know, putting her on the floor in different positions, you know, yeah, and like with time, with strengthening and stuff, she's going to get stronger in the head and neck because of all these positions that you're putting her in and encouraging her to move her neck and all that stuff.
Great, thank you.
I like, I don't know, like, how important when a baby this young is like schedule. Like,
Oh.
like, I mean, you
Um,
know,
I'll just tell you from experience, like my